Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes, and we are going to discuss questions of reading today, but will not be able to record all the questions of recording because, or will not be able to record all the questions of reading because normally when we try to record the reading, then there are some kind of noises which happen. And I want the people who are taking coaching from Dr. BKM Institutes, they should be able to participate. So we will not record too much, but at this moment, I have muted everyone. So I'm just going to do this question for you. So this question is a very special question because this question is of purpose. Whenever there is a purpose question, normally I am the one who encourage you to use elimination method. मैं ही आपको कहता हूँ एलिमिनेशन मेथड यूज करो, मतलब कि इनमें से जो दो गलत हैं, the options which are wrong eliminated. But when purpose, motto, objective, when these words are there, motto, what is the motto of the passage, what is the purpose, what is the objective, what is the goal, तो जब ऐसे क्वेश्चंस होते हैं all the three options can be correct. So आपको उन three options में से समझना पड़ेगा which one is good for us. So अब मैं इसको पूरा, so you have to read this paragraph in one shot and then you would be able to understand the purpose. So memo to staff. So that means it is a memorandum for the staff. Intravenous solution bags. Intravenous solution. IV fluids are administered via a plastic IV solution bag, which collapses on itself as it empties. So there is a IV solution bag which collapses by itself. When a bag is disconnected by removing the giving set spike, air can enter into the bag. If it is then reconnected to an IV line, air can potentially enter the patient's vein and cause an air embolism. So over here, the purpose of this paragraph until now is that I should not respike. I should not spike it again. I should not respike if I have broken the connection. So if it is reconnected to the IV line, then air embolism can happen. So one thing it is telling that air embolism can happen. For this reason, partially used IV bags must never be respiked. So I'm having two topics now. One is don't use respike, don't do respiking. Second, why? Because it can cause air embolism. All IV bags are designed for single use, for use in one patient and on one occasion only. That means it is disposable. All the registered large volume injections, including the IV bags, are required to have this warning or the words to the same effect clearly displayed on the labeling. So third topic which is going on this paragraph is first, don't respike. Second, it can lead to air embolism. And third, labeling is very important. In addition to the potential risk of introducing an air embolus. So it is again revising the same thing that it can cause air embolism. And in addition to that, respiking can also result in contamination of the fluid, which may lead to infection of bacteremia. So now it is saying to the health professionals, health practitioners. So it is reminding the health practitioners not to use the IV bag again because it can lead to air embolism, contamination, infection, and bacteremia. So four things can happen. So the purpose of this is to remind the health practitioners of the procedure to follow when using them. So are there any procedure when using them? It is only talking about spiking, that do not do the spiking again. It is not talking about the procedure when using them. So ये जो additional words हैं when using them, ये extra words हैं. It is telling about the procedure. It is not actually telling about the procedure. It is not telling go into the vein, take it at 45 degrees. So it is not talking about the procedure, but it may appear. So I'm keeping it as an option. But as far as I am concerned, and we have done in the class, it should not be that answer, because in the procedure it would have done you should put the disposable, then you should throw in the dustbin. So it is not talking about any particular procedure. So the purpose of memo about solution bag is to remind the practitioners of the hazards associated with the faulty ones. So it has not talked about any faulty bags. कोई faulty bags की बात नहीं हुई है, तो ये भी नहीं है. The purpose of the memo is to remind the health practitioners why they should not be reused. So this was the main topic. It should not be respiked. It should not be reused. Why means the reason has been given because it can lead to air embolism, contamination, infection and bacteremia. So when it comes to the purpose questions, तीनों ऑप्शंस करेक्ट हो सकते हैं, पर अगर आप ध्यान से देखोगे तो एलिमिनेट भी होगा. प्रोसीजर्स, इट इज नॉट टॉकिंग अबाउट एनी प्रोसीजर्स टू फॉलो. it does say is a protocol to follow, or it does tell a condition that you should not reuse it, but it is not talking about procedures. Then it is not talking about the faulty ones, it is only talking about why they should not be reused. Again I'm telling you, in purpose questions agar aap eliminate nahi bhi kar pate, if you are unable to eliminate, then also it is quite clear that the topic is about the reasoning why it should not be reused. So this is how you do reading, and that is how to do these purpose, motto and objective questions. So otherwise elimination method will work, but in these questions all the three options can be correct or can be very close to each other. So in that case you have to find the exact meaning. And in purpose, motto, objective, crux, gist, in these questions gist word is also there, crux is also there, infer word. So these are the words they can use: infer, gist, crux, motto, objective. So in this first line and the last line plays a very important role, a very crucial role to find the answer. So please make sure that you read the whole topic well, what topics is, and first line and last line are very, very important in these kind of questions. So this is Dr. Bhupesh from Dr. BKM Institute talking about how to do the purpose questions. And please subscribe our channel on YouTube. Our contact number is 76967 34256. Thank you.